PAR-Q, Physical Activity Readiness Questionnaire and Stratification of Risk, presented by me, Joe Prepodnik. Okay, what is a PAR-Q test? It's a cost-effective way for a personal trainer to get a health history of a potential client. It uses a self-recall of potential client to list any signs or symptoms of pre-existing health conditions. And it does help to identify individuals who would benefit from participating in a low-intensity exercise program. But there are limitations to it. And what are they? Well, it was essentially designed for the safety of exercise, but not to gauge the risk for coronary artery disease. And because of its limitations in determining positive coronary artery disease risk factors, medications, and contraindications to exercise, personal trainers should use an additional health appraisal form. An additional health appraisal questionnaire may not always be necessary, but it is advisable and useful as a more effective means in identifying potential risk factors for CAD or coronary artery disease. As a side note, I work in EMS and we do extensive health histories on patients, and more often than not we don't get what we ask for. People either forget, deny, or flat out just refuse to tell us what's going on. It makes treating somebody very difficult in that situation. The additional questionnaire is an effective tool for assessing the correct level of moderate to vigorous levels of exercise. It can help to identify possible CAD risk factors, sudden cardiac arrest, risk factors, pre-existing diagnosed diseases, recent operations, medications, supplements, and lifestyle management. Information gathered from both the PAR-Q and health questionnaire are instrumental in identifying risk factors, stratification of risk, and determining the correct level of testing and exercise. And additional screening. Depending upon how the initial PAR-Q and health questionnaire turned out, it may be necessary to move forward with additional screening of the potential client in order to minimize or mitigate risk. It will also be necessary for the trainer to cover the following areas as well: lifestyle inventories, informed consent, and release/assumption of risk management. Lifestyle inventories. The purpose of this is to evaluate the personal choices and patterns that potential clients exhibit. They can also be related to dietary intake, stress management, physical activity level, and factors that may influence a person's health, such as smoking and alcohol consumption. A personal trainer may use this inventory to augment already gathered health and fitness information in an attempt to confirm or clarify any obstacles or goals of the client. It should be noted that the majority of lifestyle assessments were developed for an average healthy population. Individuals with pre-existing health-related conditions and that have previously diagnosed by a physician may not get valid or reliable information from these results. Clients that fall into this category should rely on diagnostic information provided by their physician for guidance. Informed consent. This is where the client is given information about the content, process, and delivery system of the program. The client will get detailed program description, benefits and risks of the program, responsibilities of the participant, a confidentiality clause, and finally acknowledgement and acceptance of the terms that were described within the form. It is important that information be presented in both oral and written form, and that way there's, the client has the availability to read information and also be told the information, have the ability to ask questions and get clarification. And this is done prior to any activity being performed, and is done so the client knows and understands all the risks and circumstances inherent to the program. Personal training, children, and risk. Due to an ever-increasing population of obese children, parents are turning to personal trainers to help children lose weight. However, due to several factors, there's an inherent risk in this. One of them is because legally, children are not adults. They lack the ability to fill out all the necessary paperwork. And this has been done by a parent or legal guardian prior to any fitness program being implemented. Unfortunately, it is still unclear whether waivers, parental consent forms, or assumption of risk documents for this group are helpful or should even be administered. And this does create a problem for the trainer to be free from liability and prevent an injury claim. In many states, according to the law, children of particular ages, generally between 7 and 14 years, are incapable of self-negligence. Because of such laws, a self-negligent child is not a determining factor to limit the award of damages in the event of a lawsuit. And because children are still developing, a trainer cannot treat a child as though they are a little adult. Doing so could cause damage and possible grounds for a lawsuit. Record keeping. This is something that's critical for a personal trainer to do, and they have to keep accurate records of everything that goes on with the client. He or she needs to have all consent forms on file along with up-to-date performance evaluations of each client. Having all this information readily available will help to minimize the impact of a lawsuit if that were ever to happen. Okay, evaluation of risk. Once all of the health history has been gathered, it is necessary for the trainer to evaluate it for risks. Some of the major are as follows: CAD risk factors, family history, diet, behavior, and lifestyle, hypertension, dyslipidemia, what are levels of LDL and HDL cholesterol, issues with glucose and or diabetes, sedentary lifestyle, identification of medical conditions and diagnosed diseases, any metabolic, chronic, coronary, or orthopedic disease, diabetes, CAD, atherosclerosis, Graves' disease, liver disease, scoliosis, you name it, it's all in there. Asthma, I actually have a few of these myself, so training is really kind of a fun game. It's also important to know what kinds of medication the client is taking. Now, the interpretation of results. Once all the information has been gathered, it's then necessary to rate the risk of the client. Every client will be placed in one of three risk strata for preliminary decision-making process. Although it's almost impossible to set guidelines that address all potential health situations, using the information gathered through the health screening process will give the trainer what he or she needs to correctly categorize his or her client. Risk stratification categories. Low risk, men that are 45 or younger, or women that are 55 and younger, non-smoker, good HDL numbers, and are CVD asymptomatic but may have one risk factor for that disease. Moderate risk, these are people that have two known risk factors for CVD. Examples of this are family history, smoker, hypertension, obesity, or prediabetes. High risk people with known CVD, COPD, asthma, thyroid or liver disease, diabetes, or cystic fibrosis. This is just to name a few. Now, depending upon the risk category the client falls into, this will determine the extent of the pre-exercise work and also if the client will need medical clearance prior to starting a training program. Okay, program recommendations. Once risk has been determined and all the necessary medical clearance has been granted, the client will fall into one of three training programs. It's unsupervised. Now, this is intended for people that are at low risk and appear to be healthy. This program is a combination of weekly supervised training sessions along with self-directed unsupervised sessions. This program is intended to be long-term. Supervised. This is for people that have limitations or conditions that may limit involvement but not restrict participation. The client would be under the supervision of a trainer, and the program would be monitored or modified to meet the concerns of the client. The last one here is medically supervised. This program is recommended for people that present high risk factors or have an uncontrolled disease. This program is done in a clinical setting and monitored by healthcare professionals. Now let's move into low risk client training. Because of low inherent risk presented by a client in the strata, I would start out by showing individual basic exercises based on discussions and goals that were previously set. I would start by showing him or her, well, in this case a him, the exercises, and then have him do them under my supervision and guidance. I want to make sure that this posture and form are correct and make any necessary adjustments, and certainly answer any questions that he may have regarding the exercises, their benefits, risk, all that good stuff. And then I certainly would not let him or her be on his own, certainly not in the first training session, until we were both comfortable and confident that he was able to move forward with little to no supervision. Moderate risk client training. Prior to any type of exercise, I would need to make sure that all medical clearance has been taken care of and the client's physician is okay for the training to proceed. This training would consist of teaching client proper techniques and form and also showing him the correct way to do the exercises that have been given to him. After he's been shown the correct way, I would let him try the exercises on under my direct supervision. Of course, in this case, answer any questions, make adjustments as necessary, and at no point would I allow him to do anything unsupervised. Finally, high-risk training. Again, all medical clearance would have to be or need to be taken care of prior to any type of exercise routine. If the client wanted to do any type of maximal or submaximal exercise, it would have to be done at a healthcare facility where immediate medical attention is present. Just too many potential risks here for the person to get, I don't want to say get dead, but to have some kind of episode. And being in a gym facility and my limited medical training is not enough to care for a client. And in this case, the only thing that I would do with this client is some light resistance training. I would avoid doing anything that would get his heart rate up. And when we're excited, I just used our book. Thank you.